icebreaker question on the screen. If you could compete in any Olympic sport, which would it be and why? So just let us know on chat, or you can come off mute as we let everybody settle in. We'll give it a bit, 2 more minutes for guys to settle, then we can kick off the webinar.
Hello.
Hello. Welcome to our webinar for today. Before we kick off, we have a fun icebreaker question for you on the screen. You can answer on chat, come off mute. As we give 1 more minute for others to come in, then we can kick off our webinar. Yes, I see swimming definitely. For me, that's more of a hobby than a sport, but I love watching the competitions. Keep on putting your responses in chat. Feel free if you want to come off mute and talk about what you'd compete in as we wait to kick off the webinar. Hello, everybody. Welcome to today's webinar. As we wait for everyone to settle in, we have a fun icebreaker question for you. If you could compete in any Olympic sport, which would it be and why? Feel free to put your responses in chat or come off mute. We're just about to kick off. Thank you for your responses. I see them coming in. Sabutani, that's a good one. Yes, you have to be super fast for that. Okay, welcome everyone. If you want to answer the question, the icebreaker question, feel free to come on chat, come off mute. Just about to kick off. Hello, everyone. Again, thank you for joining us today. We have a fun icebreaker question for you on the screen. Before we kick off the webinar, I see very interesting responses coming in. Oh, I love the singing. That's a good one. That's an interesting one. Artistic swimming, because it looks very cool. It does. I love watching the synchronized diving, synchronized swimming. It just takes you somewhere else. Well, thank you. Thank you, everybody, for joining. And thank you for giving us responses to our icebreaker question. I think we can start the webinar now. So I will begin with our agenda for webinar today. We'll have an introduction to Clear Global, and after that, have some time for some discussion and questions. So to begin, I'd like to introduce you to our very esteemed speaker. Her name is Alice Casalejo. Her position is the Program Development Manager at Clear Global. And a fun fact about Alice is that she is passionate She's a passionate but always successful gardener who loves having muddy hands and twigs in her hair. That is very cool, Alice. Here in Kenya, would term you as green fingers, having green fingers. I don't know if that's universal, but that's what we say here. That is beautiful. So without further ado, I'll hand it over to you, Alice, to begin your presentation. Let us know more about yourself, and you can dive into everything Clear Global. Over to you, Alice.
Fantastic. Thank you very much, and thank you so much for starting us with a nice warm-up as well. So my name's Alice, as I was just introduced, from Clear Global. I'm also joined by my colleague Mariam, who's online, who's the head of our technology team, and who will also be able to pick up any questions that come into the chat while I'm talking as well. So it's lovely to have her with us too. So I'm going to talk today about language inclusion in digital health programming. And if we can go to the next slide, please, that would be great. So before I kind of get into the content, I just want to give you a very brief description of who we are. So Clear Global is an NGO, and we used to be known as Translators Without Borders, but we do so many more things than translation that we went through a rebranding exercise, because what we work on is helping people to get the information and to have their voice heard, whatever their language. And we work in both humanitarian and development contexts. And we provide a whole range of language support services, but also we do capacity building, we do research, we look at language use data and language data, and a whole range of language technology. So it's actually a very wide brief. Can I have the next slide, please? So in this session, I'm going to kind of go through what we mean when we're talking about language exclusion and digital exclusion and accessibility based on a whole range of pieces of research that we've been doing over the last 10 years, including a very recent piece of research with GSMA around language inclusion in digital programming. So I'm going to start with the broader issues around language in health, and then move on to the digital work in the second part of the presentation. Next slide, please. So I'm going to do a little bit of a presentation about what we know about how language includes and excludes people in humanitarian and development responses, because language has been long neglected as an area of an exclusionary factor, and it's something which is very rarely considered. Next slide, please. The key finding across all of the contexts where we've done research, and it's now, as I said, sort of more than 10 years worth of research that's backing this up, is that language is something which compounds vulnerability and exclusion, but it's something which humanitarian and development organizations really struggle to understand. And they struggle to understand for whom and in what contexts and what situations, and how they can measure it and how they can address it. So it's still kind of a big area of lack of understanding. As we know, access to education is a fault line for exclusion in most contexts. So anybody who hasn't gone to school, women and girls and people with disabilities, perhaps older adults who didn't get the opportunity to go to school, and members of marginalized ethnic groups, anybody who has missed out on the chance to go to school will very often have missed out on learning the official language or the dominant language of their country or context. So those are the groups who are most likely to struggle to communicate and understand when their own language isn't provided for. And so that means that language is compounding the other drivers of exclusion that they may well be facing, like poverty or gender or age or disability. So that makes language issue a very important issue to look at when we're trying to look at inclusion in our programming, in our health programming, in our digital health programming, because what we need to understand is that if we don't address the speakers of marginalized languages and only work in dominant languages, we're very likely to be excluding those most marginalized people who we probably most want to reach. And the part of the challenge is that the data collection processes aren't set up to account for language exclusion. So their experiences get overlooked in monitoring, in program design, in evaluation, and also in accountability mechanisms and assessments. And this compounds their exclusion, because if we can't see to what extent they're excluded and we don't incorporate them in the initial processes, we continue to remain unaware of the issues that they're facing. Next slide, please. So what I'm going to do now is spend a little bit of time, and not very much, but a little bit, on language use data, just to talk about how that can start informing our programs. Next slide, please. So humanitarian and development organizations tend to assume generally that most people in an area can speak a dominant language. But we collect language use data, and time and again, it actually shows us that populations are much more linguistically diverse than we assume. So this map represents the language use for Cabo Delgado province in Mozambique. And as you can see, Portuguese is not the primary language anywhere in that context. And if we add the gender analysis to the picture, we can just see how important it is to speak in local languages and non-written communication to arrive at communication with women. And that one picture of Mozambique that we see there, the kind of complexity of issues we see replicated again and again. But most international organizations and even national NGOs prioritize recruiting highly educated staff who have a high level of technical ability and the ability to speak to them. So people who have learned English or another colonial language, or who speak well the dominant language of the country. And that means they are less likely to be, they are more likely to be the most educated people and less likely to be from marginalized language groups. And our research shows, and has shown consistently, that they're often not necessarily particularly aware of language exclusion in their own context. So assuming that certain languages are going to reach reach significant parts of the population, particularly those from marginalized groups, is misleading. And what we need to make sure is that it's reaching those people and that it doesn't compound the lack of information that they have. So we need to assume, where there is no language use data, we have to assume high levels of multilingualism and try and gather the language data as early as possible. So it should be a key part of our program design and used to develop a communication strategy. Next slide, please. So one of the things that I was saying before is that obviously in many, many contexts, it's women who don't get access to education. And we have done now multiple pieces of research looking particularly at how language is compounding women's exclusion from information. And what we can see is that language is not a general gender neutral issue. So we know that women get, oh, sorry, can we have the next slide, please? I realize I've moved on without asking for it. Thank you. So language is not a gender neutral issue. Language needs to form a part of any gender analysis, and understanding the communication preferences to women is going to be crucial to gender sensitive programming. For example, when we've done research, we've found that pictorial and audio messages remain key factors in improving women's access to information. And to be effective, audio messaging also needs to be created in the primary languages of women through dominant channels, through channels which are accessible to them. So our various studies have shown the extent to which women have not been receiving the key messages. Also, much of the terminology which is aimed at women, for example, around family planning, tends to be developed in the dominant languages and using text. And making this technology available to people who in the languages that they speak at home and in voice enabling it can make a big step towards making it accessible. So although phone ownership is still a major barrier for women, they do often make use of technology to overcome literacy barriers. Next slide, please. So ideally, if you are planning your program, oh, could I ask you just to click once more on that slide? I think there's some of the information missing, and perhaps one more time. Oh, it's broken. I'm so sorry. Okay, apologies for that. That slide is broken. What it should be showing you is in that tiny area of Rajpur, there are only 1.8% of people who speak Urdu, and that the most common language is Saraiki. So what we should be able to do is to use that detailed information when we're looking at how our digital technology is going to work, looking at the detailed information for particular areas that we want to cover, perhaps where maternal mortality is bad or health indicators of a certain context indicate we should be programming, and we should be able to do a deep dive on the language data for that particular context. Apologies for that broken slide. That language data should give us a sound basis for our choices of language, but also play part in the monitoring and around uptake. Can I have the next slide, please? So now I'm just going to talk through a couple of the general issues around health communication for marginalized language speakers really broadly, and this applies both to online and offline communication. Next slide, please. So, in many contexts, the digital technology is designed to support national staff, for example, health workers or volunteers, to enable them to communicate key messages with community members. But to do this, they also need support to relay the messages in local languages. And our research, again, multiple studies show us that they almost never receive support on that process of translating and interpreting, although those skills are actually quite tiring and complicated and time-consuming to do them well. And they're very rarely given the information to relay in the community languages, but they're expected to take the information from dominant language resources. So these two quotes both come from North Kivu during the 10th Ebola outbreak. And that showed that many people did not get the risk in communication materials and information that they needed. And the first quote shows what that did to the trust, to the issue of trust and faith in health services. So community members were telling us they wanted information in the languages that they understood and in a familiar style, and they wanted explanations with enough detail to understand how the emergency was developing. But the health communicators who were using digital health as well as standard non-digital materials, the materials they were being given as communication tools were not properly adapted to the materials. And so they were struggling to provide clear and consistent answers. The materials they were provided were in Congolese Swahili, and they contained words in French and in English. None of those were suitable for that particular locality. And the communicators from many sectors were telling us they needed materials in plain language, as succinct and clear as possible. And they needed the key concepts to be translated into the local languages as a basis on which they could build communication. So we were leaving the frontline health communicators really vulnerable by not providing them with appropriate language communication materials. Next slide, please. So the next thing is the actual words themselves matter. And we are, as a sector, both the humanitarian and development sector and the health sector, we are, our own worst enemy in terms of creating jargon. So we talk about STIs and PEP and FGM. We talk about accountability and gender and safeguarding and intersectionality. And those are words which are difficult in English to be able to get clear definitions of. And translating them is really very difficult indeed, even to major languages. So translating them to marginalized languages, including sign languages, can be really hard indeed. So I'm going to ask you to do a quick exercise, but please don't go away. You just do this in your head. So can I have the next slide, please? So I pulled these examples out of our various projects where we've tested terms in a range of languages and contexts. And just in your own head for a moment, I'd like you to organize them into one of the two buckets, either into the orange bucket that people understood the terms easily, or into the blue bucket where people misunderstood the term. So I'm just going to go quiet for half a minute while you do that. Okay. Right. Could I have the next slide, please? Okay, so this was the actual picture if you wanted to get it 100% correct. So I'm not going to go through them all, and I know that some of them look very surprising. So for example, heart was misunderstood by the Rohingya research participants because in Rohingya there are 3 different words for heart. depending if it's a human organ, an animal organ, or an emotional center. Shock was misunderstood in Swahili and Lingala because it was meant to refer to humanitarian shock, like a short-term negative event, but everyone associated it with being shocked. Our research in healthcare facilities in Cox's Bazar and Rakhine State in Myanmar showed that local staff who are working in hospitals and health clinics struggled with this kind of communication challenge all the time with the Rohingya patients they saw. And there were lots and lots of examples where euphemisms for body parts were not being understood, for example, and instructions for medicines were really inaccessible for people. The other thing about terms is that nuance matters so much. So we found signs in Northeast Nigeria, for example, where mental health services on the outside of a centre were being translated as services for mad people, which obviously didn't drive up uptake for that centre. And discussing, for example, the onset of menstruation, again in Rohingya, taking that as an example, organizations were having to choose between two different words, one of them essentially meaning becoming big, and the other one meaning essentially entering the house, which was implying that the girl was now going to have her movements restricted and her social interaction restricted. So the weighting that people give words, the nuance behind the words really mattered. And in lots of cultures, it can be really hard or almost impossible to find non-stigmatizing words, for example, for men who have sex with men or sex workers. So we create multilingual glossaries where we test terms with community members, and they're used to support interpreters and translators to communicate sensitively and effectively. And we would really encourage you to think about how to develop the appropriate terminology with the particular work you're doing in digital health. Can I have the next slide, please? Much as we test words, we also test visual materials. And in last year, for example, during the floods in Pakistan, we tested a number of posters that were released after the floods. And at that stage, no more than 50% of men and 30% of women in the communities where we tested understood the posters correctly. So symbols like arrows and crosses were not familiar to people who had lower literacy levels. And lots of participants said they didn't understand the purpose of what they called those lines, because the arrows added another layer of confusion and people didn't recognize them as arrows as creating a sequence. Also, many of the visual images were far too busy and were trying to get across far too many messages. So in most contexts, people will commission a local artist or designer to develop pictorial material, both for digital and for non-digital communication. But we need to be aware that we need to do proper testing to make sure that those communications are effective and to make sure that we're testing with a particular group we're interested in. Because again, somebody with a high level of education who's doing pictorial work may not understand these kind of limitations. Next slide, please. Okay. So we've recently done a piece of work, sort of landscaping work with GSMA, which looked at how inclusive digital humanitarian services were for speakers of different languages, and what were the challenges and opportunities that existed to make sure that people who need and want those services are able to access them. And many of the issues we found in the humanitarian contexts are replicated in development-focused programming as well. So we heard from language specialists, for technology specialists, digital service providers, and organizations working with people who speak marginalized languages. And I'm going to take you through that piece of research now in these last few slides. Can I have the next slide, please? So most humanitarian and digital services are only available in a really narrow range of language. Many millions of people are excluded as a result of that. So just under 30% of the CSOs that we surveyed in this research said that the communities that they support have no access to digital applications in their own language. To use digital services, marginalized language speakers typically have to navigate the user interface in a second or third language. So they only do that if there's a really clear benefit. Social networking and messaging were the main uses of the services, despite the interfaces not being in people's used language, because they can use voice and video and text in any language once they've mastered the basic access of entering the system. And so they can send voice messages to each other and use it in that way. And because language barriers compound other disadvantages, those who are excluded are disproportionately vulnerable groups like women and girls and older adults, as I've said before. And there's also an urban and rural divide. Can I have the next slide, please? Almost all the research participants said that it was important to cater for marginalized language speakers, yet even the most well-resourced digital services really struggle to do so. And the main languages served are the official UN languages, with even major world languages like Hindi still being quite far behind. Next slide, please. What we also found that service providers often have very little insight into who is left out of their programming and the scale of that problem, even when they recognise that language exclusion likely exists. So they typically lack enough language use data about the population to know who is not served by national or dominant languages. The needs assessment and the user research are not reliably happening in marginalised languages, and so therefore not hearing from the marginalised language speakers. And the digital platforms are not capturing information about non-users. So finding out who is being missed requires quite considerable additional effort from the groups who are doing the development. Next slide, please. The next challenge is around the language technology. So existing language models typically don't prioritize relevant variants. So language technology is widely available in Portuguese, for example, but speech recognition is geared to European and Brazilian Portuguese and doesn't work so well for Portuguese speakers in countries like Angola and Mozambique. And while a human speaker can usually manage that kind of dialect difference, computers working on data find that it doesn't work. So in many contexts, people are quite likely only to be able to use a digital service in their second or their contact language if they speak one. So the Kinyamulenge speaking refugees from DRC who are in Kenya will use mobile money apps in Swahili, or indigenous communities in Guatemala will usually access telehealth services in Spanish. But speakers of those contact languages often mix words in from their first language or other local languages. And language models are trained exclusively on the standard variants of these languages. And so then they don't recognize these introduction words. Also, commercial applications of language technology tend to assume end users are literate and they own a device and they know how to navigate generally in the digital space. But that's actually much less true for speakers of marginalized languages. Can I have the next slide, please? The good news is that there is a lot of potential and complementarity between communities and humanitarian and development actors and development and technology partners. So all of us in the room, the humanitarian and development digital services, catering for marginalized language speakers, we generate and process high volumes of content in those languages. And that presents an opportunity to improve language technology and digital communication for marginalized language speakers. Research is significantly reducing the amount of language data that's needed to make a workable language model. To develop speech recognition in new languages, you now need fewer than 100 hours, not 10,000, as was previously the case. And also, there are much better collaborative spaces opening up to generate language data and share language models to others to work on, places like Hugging Face and Common Voice. So marginalized communities and humanitarians and technology developers, we could all benefit from collaborating on developing language technology for marginalized language speakers, using the volumes of language data, especially speech, that's generated and received by digital services. And there will be a lot of practical steps and ethical steps to make that effective and to avoid exploiting marginalized people. But greater awareness amongst service providers and the funding environment for donors could play a major role in taking us a big step forward quite quickly. The next slide, please. So what can we do to help build up language technology that works for marginalized language speakers? We can help plug the information gap on language use with user research. So neither non-profit digital services nor language technology development for marginalized language speakers is informed by data on who is using which contact languages and how. And that's a huge miss, given that the aid organizations often overestimate how many people can confidently use a second language, and they lack the data on the most relevant contact languages to invest in. So if we could systemize our efforts to collect and share this language data for marginalized language communities, it could be used to maximize the reach of digital services for users with second language capabilities. For example, some of the 22 million Swahili speakers in Eastern DRC. If we could share our own language data, So language data, voice recordings and transcripts or parallel sets in 2 or more languages, that's the raw material for language technology. So content that you're developing in or translating into, or that you record in marginalized languages to share with users, can build up this collective store of language data for health topics that you work on and help language technologists and communities to build language models and applications. And non-sensitive communications from service users, if they're cleaned of personal information and with informed consent, could be a really valuable use of language data. Also, making sure you have informed consent. This is important and it's complex for digital services. It's also vital if you want to share users' communication as language data. So in contexts where language intersects with conflict or persecution, collecting people's voice and text data can carry risks. And it's also hard to be sure that somebody's consent is properly informed when they may be perceived as a condition of aid and when future uses of data by artificial intelligences are not properly known. Language barriers exacerbate these challenges when people are not consulted in their first language and where the concepts involved in discussions of data have no legal equivalence, or there's just not a kind of mainstream discourse about language data. So investing in making sure that the implications are understood to build ethically sound, sustainable language data for social impact is really, really important. The next slide, please. So with your input and the contributions of others, we think there is scope to build like a language ecosystem in which social impact organizations and communities and technologists and language experts can collaborate to build language technology. And that will then meet the needs of the marginalized language speakers and make it available to be used for social ends and to be refined and developed and to grow into various different sectors. There are many forms in which AI can be deployed to improve access to information and services for marginalized language speakers, but it needs this base of information first. And these are examples on here of how we have put to use language technology in a range of pieces of work that we have done over the last few years. And we're really keen to work with anybody here and others to see how we can build language technology into the work that they're doing. Next slide, please. So what does it mean in practice in terms of digital programs and services? We think the most effective way of ensuring that services are language inclusive is to act on the basis of awareness and keep reviewing the evidence to see who might be getting missed and what the action that we're taking, what impact the action we're taking is having. Next slide, please. So breaking that down, we need to know who speaks what language. So that needs to be built into our assessments. We need to be doing, oh my goodness, is that slide also not coming out? Sorry. Oh goodness, my slide has lost a whole range of information. Can I swap to take over the presentation at this stage? Sorry, I realize that otherwise you're not going to be able to see this slide, and it's quite a crucial one.
Alice,
Yeah,
I
sure.
can if you want.
Stop sharing.
Mariam, if that's possible, apologies. I don't mind getting through one slide that's not working, but 2 slides that's not working is.
No, I'll share.
Thank you very much.
Let me know if you see it.
Just coming. Thank you. Okay. Oh, that looks much better. Thank you very much. So what we want to make sure is that we get the data, that we all can share and use and make public the data of who speaks what language and where, and how is language in that context compounding vulnerability. So that we can get some really good insights into each context. And I realized that my previous slide on the map also didn't come out very well, so I'm not having much luck with slides, but a lot of the work that we're doing on that is around language mapping. And what we would like to be able to do is to work with all of you in the digital space to help start to gather the language use information so that we can enhance the language maps that are available and start getting more and more detail on the languages spoken in each context. We need to make sure then that we use that information. So we need to be able to look at who speaks what languages there and research the marginalized language, and then act on making sure that information that we're trying to get to people is in the formats they can manage. So if we recognize that there's multiple languages and that's combined with low levels of education, then we need to think about voice, for example, and making sure that we're getting some kind of voice for navigation, or that we're getting content to people in audio formats. We need to make sure that wherever we can, we're getting really good informed consent for second language users, and also that we create our own content using plain language principles, and that we therefore, when people are working in their second language, which will still be the case for many people, that at least we're writing as clearly and simply as possible so that they can have the best chance of understanding it. And then the last one is that we need to find a way of working out who's not engaged, who's not getting access to our services. And the only way to do this is to disaggregate by the user data by language, and to be able to overlay that with what we know about who speaks what languages in that community. So you may be getting really high levels of uptake on your digital health platform, but if none of them are coming from community X, the marginalized language community, then you may need to think about how you're addressing it. Is it just about the technology itself? Is it about the format of the information? Is it about people not getting the promotional information in their language or through the channels that they're using? And we might need to monitor what those needs are amongst the non-users, see whether they're not finding it relevant, or perhaps they're finding some of the content inappropriate for their community. And we need to build that into our evaluations so that we understand who is missing from our language technology. Can I have the next slide, please? So we're rounding off because I'm really keen to leave time for questions. This is just a list of some of the things that we do around our insights and technology work, and also around our language services as well. We're really keen to try and find interesting new ways of collaborating, but we're also really keen to try and help people collaborate with others better. So it's not necessarily about doing things with us, but making the whole sector stronger in how it thinks about language. So I would like to share that just for reference, because I'm imagining the slides may get circulated. And I think I can just move on to the final slide to say thank you. And we would really be very keen to hear from you. I'm going to open the discussion now for a conversation, but I want to make sure you've got my email address in case you want to reach out to us and kind of get a more in-depth discussion about a particular piece of work that you've been involved in. But I'm going to open up now for questions to see whether there's anything you'd like to discuss, and to what extent you feel this presentation on the challenges of language and technology reflects your experiences. So maybe we can stop sharing. Yeah, thank you. So are there any questions at all?
Maybe I can kick the conversation off. I'm Linda Taylor from Digital Square. I just wanted to say thank you so much. This is absolutely fascinating. I particularly liked your slide, or actually it scared me, your slide with all the terms that people misunderstood. I guessed it might be most, but not all. And I think certainly from our perspective, from Digital Square's perspective, we're aware that language and internationalization is such an important component of digital health systems. And we're also very much aware it's at an incredibly nascent stage. When we're looking at translation, not just for the users, but also for the people who implement systems and the people who develop and maintain them, it does sometimes seem like a bit of an insurmountable problem. But I guess I think one of the things I'd really like to ask you is, where do you foresee ways in which we could collaborate? What is the sort of information that you would find helpful from those of us who are supporting and involved in digital health implementations or the development of systems? Yeah, could you give me some sort of idea?
Yeah, no, absolutely. I suppose So I suppose there's two areas, and I'll speak to one, and then I'm going to ask my colleague Mariam to kindly speak to the other one. So the first one really is around the language use data. So this is about the who speaks what languages and where. So as I was saying, you know, we're working on trying to collect and map that information, because what that allows organizations to do is to make the choices which can really cover a significant area. So, for example, in the northeast of Nigeria, there's I think about 39 languages spoken. And by gathering the language data, who speaks what, we were able to look at the kind of pyramid of languages. You know, what languages are going to cover the largest group of people, and then what languages would you choose next to be able to cover a significant amount. So the humanitarian response that was working in the northeast of Nigeria, we worked with partners to gather that data to make it a primary question in their assessments, in their research, in the use of digital tools, for example, so that when people registered, they were asking, what language do you speak at home, which is the key question. And that meant that looking at what was a terrifying picture, because as you say, it's a bit daunting, of 39 languages being spoken, we recognized that we could increase the amount of coverage for the humanitarian response from, I think at that stage, they were working in 2 languages, which were covering only 31% of the population. By adding 9 more, we could get to 83% of the population. So rather than trying to cover all 39 languages, we were able to use that language use data to cover the 9 most important, most significant ones. And that made a massive difference to coverage. So that's one thing, is where you're developing digital technology, if that can be one of your first registration questions, what's the language you speak at home? And you can then use that for monitoring, but you can also share that with other people working in that context. That's a big win. The second one is around sharing actual language data, by which we mean, you know, the kind of constructs of language. And Mariam, might you want to say a few words about our dreams for Lanco and how that gets shared?
Sure. Thanks, Alice. Hi again, everyone. As Alice said, repeatedly, we find out that as we try to develop language tech for different solutions, we find that voice-enabled solutions are the ones that are most inclusive, the ones that overcome the issues of literacy, difference in literacy levels, marginalized people who are disproportionately affected by lack of access to this information and to tech. But having voice-enabled solutions has a huge hurdle, which is the lack of language data. So what we've recently initiated is creating a platform, which we've dubbed Lanco, which we're using to collect language data, voice language data specifically. So as Clear Global, we also have the Translators Without Borders community, which is a community of more than 100,000 linguists, volunteer linguists, who are willing to share language, to share their time and their expertise, basically to provide language services. We started with translation, revision, but then we're also mobilizing that community to collect language data. And what language data means specifically for voice-enabling solutions is transcribed audio recordings. So you have the audio, you have the transcription, so you can start with the audio and have it transcribed, or do it the other way around. In our case, for example, we're creating what we call the corpus, and we're having the community do the recordings. And ultimately, we end up with a data set, which we will make openly available. And this is the first step, And this would be the first step towards creating what we call language models, which are the models that our engineers would then train so that they can understand speech commands and just regular speech and transcribe it. And again, that would be a step towards then understanding what is being requested and getting the information. So, so creating the language data, creating the language models, and then creating applications on top that would benefit from those models makes information accessible. Coming back to the question about where your role is, it would be very helpful to be aware of what potential language data you have. You're exactly in contact with the communities that we want to enable with voice applications. And you have different programs. You might get calls from them. Of course, as Alice said, there are, of course, issues about personally identifiable information, sensitive information. So it would be good to start thinking about which part of this data can be shared and then either transcribed with your support or made available for others to transcribe, because ultimately, for this to be scalable, it needs everyone's involvement. So again, we're building the platform, but in reality, we're just creating the first step so that this becomes scalable and others can then get on board to move it forward. Because you will always find someone who's able to build an application or a model, but collecting the data is really the tricky part, whether from cost point of view or time point of view, or availability of resources, being able to mobilize communities. So if you start considering, and we can have this exercise together, if you start considering what portion of your data can be shared without infringing on any issues, how it can be made available, how to break it down so that it's short clips that can be transcribed. We've recently been in contact with a partner that is a radio, and they have transcriptions. So this is ideal, basically, to start cutting it and making it available. So thinking about, what kind of data can you share or collect, and making it available, so that step by step, different organizations can build on each other's efforts so that collectively we can enable communities. Specifically for speech, I'm speaking, because again, that's the main barrier for a lot of, that's the main enabler, basically, for a lot of communities. Back to you, Alice.
Thank you very much, Mariam. So those are two ways in which we feel collaboration would be really useful. Is around the language use data and around the language data, those two areas. The other thing that I think is sort of critical for all of us to do is to begin raising this issue of lack of access to service for marginalized language speakers by doing good evaluations and making sure that it's part of our consistent monitoring data. Any other reflections or questions?
Hi, thank you, Alice. Hi.
Hi. Thank you.
Hi, my name is Abhishek. I'm here from India. I'm leading the product for e-government foundation. So basically, we are building products for health campaign management. So we have been working closely with the countries in Mozambique. So we piloted in Mozambique. So this was a very, very insightful, especially the data that you showed for Cabo Delgado, which is one of the provinces we'll be working with. And this is an area that we never actually, at least from my point of view, we never invested that much. So thank you for this. So my question to you is that when it comes to low resource country, I think probably there's some lag. I will turn off the video for now. So in countries where there is low resources, so how do you, what do you see the challenges will be when it comes to voice-enabled digital tools, where there will be limited access to internet or limited storage for mobile devices, etc.
Do you want me to take this, Alice?
Yes, please.
Sure. So thanks, Abhishek. So the first step is to actually, sorry, let me go back. Are you asking about collecting the data within that context, or making applications accessible?
I'm talking about because where I'm coming from is that we are building digital tools for health campaign workers who will be using the app tools to collect information from the beneficiaries or the population, right? So most of the people, the workers we have worked with, they are they can speak or the most common language, for example, Portuguese. So at least from my understanding, that's how they were recruited also. Like that was one of the conditions for recruiting as the worker for the campaign. So if you have to make the tool more voice enabled. So we will have to look into the limitations of the devices procured by the MOH and the ministries of health, because that will have limited storage. It will, I mean, especially also, when you have to sync the data, so there will be challenges in terms of, because the data data have to encode as well as data captured. If it is voice, anything record voice or images will have much, have more, require more space and more bandwidth, internet also. So yeah, that's for my question. How can we address that?
Okay, so there are multiple approaches. One of them is, for example, we've implemented a solution which we call Tiles, which can store information offline. So it can store the model, the voice model offline, and it can interpret voice commands on the spot without internet connectivity, and it can pull information directly to address the queries that it has. It's all hosted on that device. It's, if you're aware of any tech, it's Raspberry Pi, and it worked, but it needs, of course, update every few, depending on that data collection. So and the updates on our end, we can update the information back to the device, synchronizing it in a sense. So that could be an option to address the lack of connectivity in some areas. At the time, again, we worked with Raspberry Pi and we had to assemble it, but with the advancement of tech, this can be done on an Android device, where you can build applications that are locally hosted with the models in there. So that is another option. What else did you ask? Does that address? Did I miss anything?
Yes. Yeah. Thanks, Maria.
So yeah, I mean, there will be issues with connectivity. We face those sometimes. For example, if you're working on a browser, again, you save things offline until you connect, and then you can't upload or synchronize or whatever. But specifically when it's voice and you need something that interprets what you're saying, we've tested with this Raspberry Pi and it works offline. And again, newer tech would address that. But
Sure.
as I said, this is an effort that, I mean, we're not doing the whole value chain at this point ourselves, and we don't plan to. We don't want to own this. We're enabling with the creation of language data, and we're hoping that local tech partners would then pick this up. We're supporting with the models for some languages, but ultimately the whole idea is for this to move so tech partners would then pick it up and build the applications to address the local needs.
Okay, thank you. If you have any resources that we can refer to, that would be great. About the implementation that you talked about. Thank you.
And maybe I can also just jump in, because one thing that you've said is also being reflected perhaps by Christine in the chat, which is around support for community health workers. And to help them better communicate. This actually comes back to this piece of research that we did previously, where what we found was that community health workers and a sort of a whole cadre of junior staff, social workers and teachers and others were really struggling with relaying key concepts, because they were getting it in an official language. And in fact, Mozambique was part of our study, I think, on that case. So they were getting it in Portuguese, and they were being expected to relay it into local languages when they had conversations with community members. So in this case, what they were asking for, they said they didn't necessarily need everything in translation. What they needed were some of the key concepts translated. So for example, vaccine or COVID-19 or vulnerable, like some of the key concepts that they were having to work with were the ones that they needed a local translation. And so essentially there was a little bit of translation that they would have found enormously valuable. So even where people are recruited because they speak the dominant language, actually their job is to relay this into other languages very often. And that's something that they find quite difficult. So a little bit of translation support can go a long way, not necessarily having translate whole platforms, but to be able to put a link on some of the key concepts so that they can see a very short, one sentence translation of a couple of the key concepts that they're going to have to discuss with people. And that can be really important. I'm just going back to the chat because I see questions coming in there. Okay, yeah, okay. So this is about people being open to sharing language data or resources for the models. Good question. Do we find people open to doing so? I think it really very much depends on the people. I think NGOs have been more open to sharing it than government services have been. But government services in some contexts have been very open to widening the scope of languages in some contexts. So for example, in Mozambique, when we worked with the government there, they were very keen on widening the scope of the hotline services that they were providing. On the other hand, in some contexts, language is a very political issue and governments are very reluctant to even sort of recognize the importance of some of those marginalized languages. So it can, it's a very divisive issue. So I'm afraid I don't have a single answer for whether people can share the data, and if they don't, it's a real loss to the community, I'm afraid. And then another question from Violet. Let me just read this one about inclusion. Do Clear Globals include sign languages to mute people, including Clear Global's works and missions? Okay. Yes, we have just recently produced our first few glossaries, including sign languages. And we're really happy to do that. We have a very broad-reaching MOU with the World Federation of the Deaf, and that allows us to access their federation network to develop work on sign language. What we'd also like to do is to bring sign languages into our language data, our language use data, so the who speaks what and where mapping. And that hasn't yet started. So we've started work around terminology. We have sign languages embedded in some of our glossaries, not all of them, but some of them. But the who speaks what languages, when we spoke to the World Federation of the Deaf, they said they don't know how many sign languages there are in each of the different countries where they have federation offices, for example, and getting the names of the sign languages recorded and finding out how many people speak which of the sign languages would be a really important first step. And they're very keen to collaborate on that. So again, if anyone's working in this area and can build some of that language use questions into their sort of registration processes or whatever, that would be a wonderful help, both to the local federation and to the World Federation of the Deaf. In terms of other areas of inclusion, we have made a decision that we are not capable at the moment of working into Braille. And we use our work in audio, or we do a lot of work in audio. Any translation that we can do a voice recording of it as well. We use that as our approach to working with people who are partially sighted or blind. So that's our approach to that particular field. So thank you, Violet. If there's any other questions about that, do let me know. It's relatively new work for us. Any other questions? I realize we only have a couple of minutes left. Okay, well, there's no questions coming out. Thank you very much for the discussion, and I'm going to hand back in that case. If you want to do any kind of closing or final comments, Luciana, then that's fine. Otherwise, thank you so much. It's been really a pleasure talking to you all.
Thank you so much, Alice. That was a very insightful presentation, and I think you and Mariam really brought out the crucial role that language inclusion plays for the marginalized language speakers. This has all been very interesting and insightful to me, and I'm very keen to reach out to understand more. For everybody who joined today, thank you for joining. We will share with you the presentation and the details for Alice's email and any of the links that have been shared in chat. And yeah, and we can pick the conversation from there. Otherwise, thank you, everybody, and we'll meet again during the next webinar. Thank you, and goodbye.
Thank you so much, Luciana.
Thanks, everyone. Bye.
Goodbye, everybody. Thank you.